Steps 1 through 5 may be performed in any sequence. Assess the size and location of the wound to be dressed, patient's level of comfort and need for pain medication. Check the prescriber's orders for the type of dressing change to be performed. Gather equipment and supplies. A disposable gloves, tape, sterile saline solution, ABD pad, 4x4s, sterile syringe, cotton tipped applicator, sterile gloves, trash can, and raise the bed to an appropriate working height. Identify patient, explain the procedure, provide privacy, drape the patient to expose only the wound site. Place a receptacle or bag at a convenient location for use during the procedure. Perform hand hygiene, apply disposable gloves. Remove old dressing by pulling tape parallel to the skin towards the dressing. Be careful not to pull against the wound. Carefully remove gauze dressing one layer at a time, taking care not to dislodge drains or tubes. If dressing is stuck to wound, you may pour a small amount of normal saline over dressing to moisten the old dressing for easier removal. Observe color, odor, character, and amount of drainage on dressing. Dispose of soiled dressing in trash can. Inspect wound for color, character of drainage, presence of sutures or staples, presence of drains. Report any brisk, bright red bleeding or evidence of wound dehiscence or evisceration. Remove and dispose of gloves. Perform hand hygiene. Open sterile supplies and create a sterile field on your bedside table. Open sterile basin of 4x4s.
Again, you want to open away from you. So we're going to loosen this and open away from us.
Open saline bottle and lip into trash can. Pour saline into basin of 4x4s. Open sterile syringe. I lied. Don't open that. Open sterile glove packaging and fold open onto table. I'm sorry. Now, open sterile syringe. Add to sterile glove packaging without touching unsterile surfaces.
Okay. I'm going to open about the first inch of this and then hold it through this packaging with the paper side and then pull down the plastic side. Okay. And I'm going to drop it onto my sterile field. Okay. I want to drop it onto my left glove or your non-dominant glove. Okay. Sterile can be over sterile and drop. Okay. Because I'm going to have to put on my right glove in a minute. So I'm going to try to put everything over on my left glove first because I'm right-handed. Also, you want to make sure anything I drop on here stays within my 1-inch border or it's considered unsterile. Okay?
Open sterile cotton tipped applicators. Add to open sterile glove packaging without touching unsterile surfaces. That's beautiful. Open sterile 4x4 gauze package. Add to open sterile glove packing without touching unsterile objects, surfaces, and objects, both. Open sterile ABD/combine pad. Add to open sterile glove packaging without touching unsterile surfaces.
You have 2 packs of 4x4s to open, so go ahead and open them both.
Okay.
It's inside my 1-inch border, so I'm good.
You in there. Okay. Apply sterile gloves.
Now, can I move this stuff to get to my other glove? It's sterile, I'm sterile. So I'm going to begin to move it around so I I can get to my other glove. Okay. The tiger's thumbs. The glove on. Bring it in.
Aspirate saline into sterile syringe.
So pick up my sterile syringe. I'm not going to reach over my sterile fields here.
Use syringe and allow solution to flow gently over wound.
So I actually drew up saline. It's in there. Okay. But I'm not going to put it on my mannequin. I'm just going to pretend I'm irrigating it. Okay.
Continue until irrigation flow is clear. Prepare 4x4 gauze as a fine mesh layer. Gauze should be moist but without solution dripping.
So you're going to unfold it into a single fine mesh layer.
Apply moist fine mesh gauze as a single layer directly onto wound surface. If wound is deep, gently pack the wound with cotton tipped applicators. Do not touch the outer edges of the skin with the packing material. Apply dry, sterile 4x4 gauze over wet gauze. Cover with a large ABD pad. Dry surrounding skin with remaining 4x4s.
Once you've placed that ABD pad, that's the end of your sterility.
Apply tape over the dressing. Ensure that all edges are covered and tape is neatly placed. Dispose of supplies. Remove gloves. Perform hand hygiene. With marker or pen, place date, time, and initial on corner of dressing. Assist patient to a comfortable position. Record and report wound appearance, patient's response, and characteristics of drainage. Sterility is maintained throughout the procedure, and you follow the correct sequence of actions.